Yes, we think that the industry will be able to restart following the rollout of the vaccination policy everywhere. And the interesting point is that we are asking states to put together reopening plans that are consistent with their vaccination strategy. The UK has paved the way and done a very good job in that respect. So Germany is following. So we are hoping that many countries will be able to put together these plans of reopening consistent with the vaccination strategy, so we will be able to restart safely the industry and the travel.
There's been a lot of talk about some kind of vaccine passport. How do we get an international system in place that everybody will abide with and that will also protect the privacy of the users?
What we are developing in IATA, we are not the only one, but we are developing a tool that could be downloaded on your smartphone, and that will certify that you have been either vaccinated or tested, or that you have had the COVID, so you have been tested with the antigen system. And so it will give confidence to states that things have been done properly and are compliant with the requirement to enter into their territory. So it's a key tool. Then these tools can be used or not by states because it's a sovereign decision as a health passport. And our app maintains the control of all this medical personal data by the passenger. It is not stored in any database that we could control or that any government could control. It's under the control of the passenger that decides to transfer this data to the state or to the airline that requests it. So that's an important point.
Alexandre, I want to jump in and ask you about hotel quarantines as we discuss more tools around testing and vaccines. A lot of countries are still requiring mandatory hotel quarantines. I know Ireland is even looking at that process soon too. It's a mental and cost hurdle for some travellers. How do you view the situation?
We have always said that quarantine was the main blocking point for travel, first of all. Secondly, if you charge the passenger with a 2 weeks stay in a hotel, it becomes almost outrageous, financially speaking. And what we said is that quarantine should be avoided, provided you have a testing system, a systematic testing system, plus a vaccination. Then, quarantine becomes, we think, not necessary to reduce the risk of reinfection, of reimporting the virus in the country. So of course, we are not in favor of quarantine, provided there are alternative testing or vaccination systems that may demonstrate that you are safe.